For both my wife and I, we work in the NHS, so I'm non-clinical and administrative, but she's a doctor. So it's when we miscarried, it was a bit of a shock for us. It's not great for anybody who works in the health service when they get sick and then have to use the NHS. But for this particular situation, we were definitely out of our depth. So initially, putting the policy to one side, when I found out my wife was miscarrying, I was still on site, and she called me very anxiously and she wasn't sure what to do. So I went round to my bosses just around on this corridor and said, look, I've just had a call, I really need to go. And their first response was, what are you doing here? Just go. That's really important. And so from the moment before we even started talking about that policy, I felt like I was being supported. When we did find out, so my wife was working in a hospital at the time when she found out, just at the start of her shift. And I went across to there and we found out that we had unfortunately miscarried. In terms of the impact this policy had on me as an individual, I felt like I didn't have to worry about work, because that pressure of everything that was going on, it was a really busy time in general, with lots of things going on. But in that moment, I didn't have the headspace to think about it because I wanted to focus on my wife. So this policy just allowed me the headspace to focus on what was important to me, what was important to my wife, and how we try and come to terms with what's happened. So then when we transferred care back to the Women's Hospital and had the miscarriage confirmed again, so then I contacted my boss who I was speaking to before and said, unfortunately it is a miscarriage, I really need to be there for my wife. They then said, there is the pregnancy loss policy and there's support in there for partners. And so it allowed me to just keep that headspace and focus on supporting my wife. It was a really numb time for both of us. And just being able to completely detach from what was going on at work and have that time to just be us, because it was going to be just us now. It really helped just to value the time that we had together. We weren't okay, we weren't happy at all, but the fact that we were able to support each other, and the fact that even though she worked in another organisation, the fact that we had this policy, and even though it's she works in another organisation, I was then able to support her, which was absolutely the priority that I had in my mind. So I think the benefit from my perspective, was that I just didn't have to think about work at all, because I wasn't thinking about work. Whatever I would have done if I was here wouldn't have been to my normal capabilities, because my mind was clearly distracted. So headspace and time to grieve, I guess, was what we got from the policy. I think it's really important. And I'm not just saying that as someone who's benefited from the policy. Even around pregnancy, let alone miscarriage, there's always the discussion about when you start telling everybody else that you're pregnant. So then to then go through a miscarriage and traditionally, if this policy wasn't in place, people would have had to have taken sick leave to be able to grieve and physically come to terms with what happened. So the sheer fact that there is a policy that's available specifically around pregnancy loss, I think it helps open that conversation. when you naturally tell someone something that's traditionally stigmatizing or taboo, people retreat out and really don't know what to say. But this, I genuinely have been able to say I was supported because I knew that this support was available, and it's helped me talk more openly about it. I think, and I talked to my wife about doing this before I came and did it, and she said she's found it easier to talk, and that the fact that we have this policy at BWC is a really progressive step, because it helps, like you say, break down that potential stigma that's there. When someone loses a family member, they're offered compassionate leave. The immediate reaction is not to make them take sick leave, because you recognise that's not a normal situation. And so even though this fetus never left my wife and entered the real world, it's still a loss that she and I will remember for the rest of our time, for the rest of our lives. We'll remember this period. There were 5 days, for instance, for me where I was not at work, which my team rallied around and covered for what I was doing. But that act of just giving 5 days is an act of kindness and compassion, so that if you need more time, then you employ the sickness policy. But actually, it's a basic act of human kindness to be able to give people that space and grieve, because it is a loss and grief that has happened. And so if we would do it in the situation of a very close family relative, I don't know of any other situation where it could be any closer than with a pregnancy loss. And so to me, it just makes sense. If an organisation considers themselves as inclusive, compassionate, and progressive, adopting and implementing this policy is a leading by example way of showing you embody those ideals. In interviews, we're always asking people, whether it's in the NHS or outside of the NHS, how do you embody the values of our organisation? But that, I feel, goes both ways. How do our organisations embody their values? And with BWC, this is such a compassionate policy that it recognises that it's a situation that happens to 1 in 4 women, that it does happen, and that people need time and they need that support. And so the benefit is that you can actually live by the words you're saying as a value as an organisation. But then the benefit to organisations is that when those people do come back, they are much more ready for having had a time to grieve, rather than treat it as sickness. That when they do come back, there's the potential that they will be in a better headspace and able to do the work that they were doing before. They're not going to be the same person, because this type of event changes your lived experience. So I know that the way I look at pregnancy and pregnancy loss is not going to be the same. But it has made me better for it. There's a more, not that I wasn't compassionate before, but there's a certain appreciation that I now have that, had I not gone through that, I wouldn't have had. And I think this policy helps organisations to do that, whether you're a member of staff receiving the support or a manager trying to give that to support to someone. It gives them that facility to have that conversation and give people that support. I think what it does help is give you that time and space as an individual. So I was very conscious that I wanted to be there for my wife, that she was going through something quite traumatic, and that there are times where whilst she wouldn't necessarily have wanted me there because of what was going on physically, she did want my support. And knowing that I had this time available meant I could focus solely on supporting and talking with her about how we were feeling. So I think it's just it's a facilitating policy more than a guidance of how to deal with it. It recognises that it's not an easy thing to have gone through. And if particularly for partners, well, that's the capacity I guess I'm speaking in. It's really difficult to watch someone that you love and care about go through this and go through pregnancy loss. And I think that this whole experience is something I'm never going to forget as an individual. But being able to have that time to just talk, or sometimes just be able to just sit with my wife and just be able to physically be there and say, or say nothing at all, as if we knew everything's not okay. It's not going to be okay in an hour. It's not going to be okay tomorrow. But one day it will be.